Hello, I'm Julian Mark, Acting Chair of JRCALC and Executive Medical Director at Yorkshire Ambulance Service. Welcome to this short video presentation for the JRCALC Clinical Update 124, the first release for 2024. I'll give you an overview of the updates that have been introduced in this latest release and also point you to further video presentations that go into more detail on some of the bigger updates that have been completed. So in 1.24, hemorrhage during pregnancy has been removed and replaced with 3 new standalone guidelines for bleeding in pregnancy, up to 20 weeks, after 20 weeks, and postpartum hemorrhage. Major complex and high-risk incidents has been updated by NARU on behalf of JRCALC, and medicines updates including a full review of sintometrin and misoprostol. We've also updated pulmonary embolism. This has been reviewed and updated in line with NICE guidance. Some small changes relating to the use of the Wells score, and the guideline now suggests conveyance could be to same-day emergency care as per local service pathways. We've updated cardiac rhythm disturbance. This has been revised and updated. It includes a new algorithm for bradycardia, which is based on the RCUK algorithm. Fist pacing has been removed. We've added emphasis on always taking a defibrillator to any patient with suspected cardiac rhythm disturbance. In the same vein, implantable cardioverter defibrillator has been revised and updated. There is amended wording on DNA CPR and respect and the use of ring magnets. We respond to new evidence and many queries and feedback that we regularly receive, and this has led to a few small changes in this update. So with GTN and heart failure, we reviewed the evidence of benefit for GTN in heart failure and considered if GTN should remain as an indication. We've had input from a heart failure expert, Dr. Lisa Anderson from St George's University Hospital, London. We decided it shouldn't be removed completely as it's part of both the NICE and Heart Failure Association recommendations. However, it's not suitable for all patients. This led us to amend the indications, so GTN indication changed from breathlessness due to pulmonary edema in acute heart failure when systolic blood pressure is greater than 110 millimeters of mercury to consider administering GTN in acute heart failure with ischemia or uncontrolled hypertension. The heart failure guideline key points change from consider administering furosemide and/or GTN and/or nitrates to considering administering IV furosemide and consider administering GTN in acute heart failure with ischemia or uncontrolled hypertension. For hypothermia and cardiac arrest, we received a query about the clarity of our wording about medicines given during hypothermic cardiac arrest, and this has been tweaked and clarified. Hypothermia and cardiac arrest drugs. The amiodarone contraindication has been removed, so no contraindications in the context of the treatment of cardiac arrest, and replaced with do not administer amiodarone when the patient's core temperature is less than 30 degrees C. Adrenaline 1 in 10,000 has moved from cautions to contraindications. Do not administer adrenaline when the patient's core temperature is less than 30 degrees C. In the ALS section 10.4, a new word has been added. Where core temperature is less than 30 degrees C, no drugs should be administered until the temperature reaches 30 degrees C, at which point double intervals for adrenaline should be used. A maximum of 3 shocks should be delivered to a patient in a shockable rhythm below 30 degrees C. Note, consideration should be given to where trusts do not have equipment to differentiate between less than 35 and less than 30 degrees C. In these cases, double intervals between medicines should still be used. All the updates for 124 can be seen on both the JRCALC Plus and ICPG apps within the guideline update box at the bottom of the dashboard. Users will also see the updated tag on the guideline or medicine itself with the guidelines and meds tabs. I would like to thank all the paramedics, midwives, doctors, pharmacists and other clinicians and many more who've given up their time to contribute to these updates. We are always keen to hear any feedback, so please do get in touch.